You're hearing the Paul W. Smith Show. News Talk 760 WJR.
Well, obviously, everyone is talking about the unfortunate accident, how severe it was for Tiger Woods, causing significant injuries. And now, at one point, they said yesterday, both legs, now they're talking mostly about the injuries down his right leg and having to use rods, pins, and screws during what was described as a long surgical procedure by orthopedic trauma specialists at Harbor UCLA Medical Center. And a statement posted on Tiger's Twitter account late yesterday said that Tiger was awake, responsive, and recovering in his hospital room. That was certainly good news. Now, we don't have any of the doctors available that actually worked on Tiger, but luckily, because we're here in Detroit, we have some of the best doctors in the world, including our next guest, Chief of Orthopedic Surgery and Chief of Trauma Surgery at DMC Detroit Receiving Hospital, Dr. Rahul Vaidya. And though he hasn't worked on Tiger in this injury, he can answer some questions and give us some insight. Doctor, welcome to the Paul W. Smith Show at WJR.
Thank you, Paul W. Pleasure to be with you.
Well, it is our pleasure, Doc. It's interesting because as someone in your profession and your specialization, I'm sure that it becomes extra intriguing and interesting when a very tough situation like this occurs with a world-famous figure, and you can't help but think about it, and think about, because you know in learned ways exactly what's going on, at least to a point. I know you haven't worked on Tiger, but can you give us just a little bit of background and information when we know that they need to insert those rods, pins, and screws, and what Tiger might be facing?
Well, there's a couple of things that the docs mentioned, and I'll just say that Harbor UCLA Excellence Center, very good orthopedic traumatologist there. And it looks like he's got a fracture in a couple of parts of his tibia and his ankle, from what they've stated. And they also released the fascial compartment, so he may have also been at risk for a compartment syndrome. But what does
that mean?
Often when you have a significant trauma to the leg, and particularly the lower leg where the tibia and fibula are, the damage to the muscles, not just the bones, leads to swelling and can lead to muscle damage. So what we often do is we release the envelope that's around that so that the blood supply remains and that the muscles have a better chance of surviving. And so that's what was done for his lower leg. They did a 4-compartment fasciotomy, from what I can tell, and they put a rod into the tibia, which goes inside the bone and stabilizes that. They also said the fractures were open, so that meant it's a compound fracture, which means that the bones are open to the skin or out of the skin, and you need to actually wash the bones very well, treat them with antibiotics in a timely manner, and then align them. On top of that, it sounded like he had an injury to the ankle. It could have been a comminuted injury, so multiple fractures, so they had to put that back together. And that's where I think the plates and screws come in at the bottom. But it sounds like a fairly complex injury, but the biggest thing is that if you have a good blood supply, then the other things, most of the time, expert doctors like at Harbor UCLA would probably do a very, very good job putting that together. And then you have to worry about the soft tissue like the muscles and skin.
Dr. Rahul Vaidya, Chief of Orthopedic Surgery, Chief of Trauma Surgery at DMC, Detroit Receiving Hospital, giving us his thoughts, his views. He obviously didn't work on Tiger, but he's worked on a lot of injuries like this one. Suffice to say, this is complicated and severe in its nature, especially for someone who makes a living using every part of their body, including their legs and their ankles. And it seems to me, it just sounds to me like an ankle breakage is even more complicated because ankles are so complicated in themselves. and wanting to get those back so that they work naturally and normally and give him an opportunity to get back to golf. And, of course, once everyone knew he was going to be okay, that was, let's face it, the next question. Is he going to be able to play golf again? I don't know that there's any way you can give that kind of an answer at this point.
It would be hard to say, Paul W. The big thing about the PGA Tour is you have to walk the 18 holes. And with an injury like this, it takes some time to be fully weight-bearing and have the bones heal, but it can be up to a year where you can walk very well. Tiger's a great athlete. He's rehabilitated from his back surgeries, and I'm sure he's going to have some expert therapists and doctors as well as his own motivation, which is a huge part of the recovery.
Good point, Doctor. Well done. We appreciate your expertise. Anything else we need to know?
No, it's just a pleasure talking to you. I think the last time we did this, we were on Minds of Medicine about 15 or 16 years ago.
Oh, my goodness gracious. That was a while ago. That was, I think, I'm not blowing my own horn, I'm blowing their horn for putting it together. I think they did a good job on that show, and we probably helped a lot of people on that television show. And we
did a great job.
We did it with great experts like yourself, Doctor. Thank you so much.
Yeah, have a great day, Paul.
You do the same, Dr. Rahul Vaidya, again, Chief of Orthopedic Surgery and Chief of Trauma Surgery, now at DMC Detroit Receiving Hospital on the Paul W. Smith Show at 6:45.